Hello, here we go. Exercise prescription for intellectual disability or ID and Down syndrome, which is DS. Intellectual disability, or formerly known as mental retardation, MR, is the most common developmental disorder in the United States with an estimated prevalence of 3% of the total population. The ACSM has defined ID as a significant sub-average intelligence, 2 standard deviation below the mean, or an IQ of below 70 for mild ID and below 35 for severe profound ID, or having limitations in 2 or more adaptive skill areas such as communication, self-care, home living, social skills, community use, self-direction, health and safety, functional academics, leisure, and work. And the level of care an individual requires, and this is all prevalent before age is 18. Fun fact, 90% of all individuals with ID are classified as mild ID. The cause of ID is not known, but genetic disorders, birth trauma, infectious disease, and maternal factors may contribute. Other factors that may contribute would be maternal drug or alcohol abuse or use, malnutrition, or poverty. Individuals with ID are perceived to have a low levels of physical fitness and physical activity and high levels of obesity compared to the general population. Cardiovascular and pulmonary disorder are the most common medical problems in individuals with ID except for Down syndrome patients. Individuals diagnosed with ID are usually classified as having Down syndrome or without Down syndrome. There go the severe and the mild cases of ID. For individuals with Down syndrome, infection, leukemia, and early development of Alzheimer's are the most frequent causes of mortality. Okay, for exercise testing, the health screening should follow a general ACSM guidelines except for Down syndrome patients. This is because up to 50% of the individuals with Down syndrome also have congenital heart disease and high incident of atlanteoaxial instability, which is excessive movement in the joint area between vertebrae C1 and C2, usually caused by ligament laxity in Down syndrome patients. A careful history and physical evaluations of the individuals is needed, including children. Physician supervision of cardiorespiratory exercise tests are also recommended for Down syndrome patients regardless of age. Familiarization with test procedures and personnel is required, so making several trips to the testing facility may be necessary depending on understanding and motivation. Making the patient feel valued and safe is key in having successful test sessions. Make sure to select appropriate tests for each individual session. Now, for cardiorespiratory fitness testing, treadmill walking or the Rockport 1 mile walk is what I prefer in the beginning until they can build up to something else, which may be like a 20-meter run test. For muscular strength and muscular endurance testing, weighted machines, isokinetic and isometric testing is recommended. Definitely no free weights. For body composition, BMI, skin fold test, waist circumference, and DEXA can be used as well. Flexibility will need to be accessed by joint-specific goniometers and sit and reach tests, because maximum heart rate is different in individuals with ID, especially in individuals with Down syndrome. The standard 220 minus age formula cannot be used. It is recommended that the population-specific formula found in our book or on the PowerPoint be used as a guide during exercise testing, but should never be used during exercise prescription. All right, now on to exercise prescription. The aerobic exercise, the frequency should be 3 to 7 days with 3 or 4 days of moderate to vigorous intensity and light intensities on the other days. The intensity should be 40 to 80% of the heart rate reserve, and because RPE, rate of perceived exertion, is not appropriate. The time is 30 to 60 minutes a day and can be done in bouts lasting 10 to 15 minutes or 5 to 10 minutes. However you can do that. Type, like I said before, walking is recommended activity to start and may progress to running. Swimming and combined arm and leg hygrometry are also effective. So now on to resistance exercise. The frequency should be 2 to 3 days a week. The intensity should be 12 reps at a 15 to 20 RM for the first 2 weeks, with progression up to 8 to 12 rep max at 75 to 80% of the 1 rep max. The time should be 2 to 3 sets of 1 to 2 minutes of rest in between. The type machines are weighted machines targeting 6 to 8 major muscle groups, and close supervision is recommended for the first 3 months, maybe more, depending on progression. All right, here's the special considerations. Most individuals with ID require more encouragement during both exercise testing and training than individuals with ID. Motivation can be a problem. Many individuals with ID are on various types of medications, so know the side effects of these during the exercise. Many individuals with ID have motor control problems, poor coordination, creating balance and gait problems. Thus, most individuals with ID need to use a handrail during treadmill testing. Most individuals with ID have a short attention span as well. During exercise testing and training, careful supervision is required. Careful spotting and supervision is needed during the beginning phases of the resistance exercise training, even when using machines. Because of the limited attention span and limited exposure to exercise, varied activities are suggested to maximize enjoyment and adherence to the program. Individualized exercise training as much as possible. Avoid group training. For Down syndrome patients, individuals with Down syndrome have a very low aerobic capacity and muscle strength. Often levels approximately 50% of the level expected for their age and sex. Individuals with Down syndrome are often obese, and severe obesity is not uncommon. Almost all individuals with Down syndrome have low heart rate max, likely causing the reduction in catecholamine response to exercise. This is why the RPE is not recommended during testing. The likelihood of a congenital heart disease and the high in individuals with Down syndrome is not unusual for individuals with Down syndrome to have, and it's not also unusual for them to have the atlanteoaxial instability. Thus, activities involving hyperflexion and hyperextension of the neck is contraindicated. Many individuals with Down syndrome exhibit skeletal muscle hypotonia coupled with exercise joint laxity. Increasing muscle strength, especially around major joints, knee, shoulder, hip, is a priority. Finally, physical characteristics such as short stature, short limbs, digits, commonly coupled with malformations of feet and toes, and small mouth and nasal cavities with large protruding tongue may negatively impact exercise performance. Thank you.